Diagnosis of gastric cancer is actually very simple. A simple test called an upper GI endoscopy, which is done as a daycare procedure. You can walk into a clinic, get an endoscopy done, and walk out immediately. So this upper GI endoscopy done diagnoses 95% of the gastric cancer. So sometimes patients can have early gastric cancer, like in Barrett's esophagus, or in the early changes, precancerous changes in the stomach lining. For these, nowadays we have special tests like narrowband imaging. So narrowband imaging is a test which you do with the endoscopies. It's called NBI endoscopy, endoscopy with narrowband imaging, which can detect these precancerous lesions. And sometimes in patients with early cancer, we might also need specialized tests like endoscopic ultrasound because the stomach has 3-4 layers, and the endoscopic ultrasound helps us see which part of the stomach, in which layer of the stomach the tumor is, and based on that you can decide on endoscopic treatment. Once you have a tumor, we do something called a biopsy and sometimes specialized tests called immunohistochemistry to identify which type of cancer it is. So by that you identify the type of cancer, and once you have a confirmed diagnosis of gastric cancer, then we may do tests like endoscopic ultrasound, a CT scan or a PET CT scan to stage the gastric cancer. Staging of a cancer means trying to identify where it is. Is this tumor limited to the stomach? Is it spread outside the stomach to the lymph nodes? Has it spread elsewhere to the liver or the lungs? So based on this endoscopic staging and the CT scan, PET CT scan staging, we decide the treatment of gastric cancer.